Hi, this is Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond, and welcome to Video Wednesday. Today we're back on the bed, ladies. I got a really cool letter from a mama saying, I have so much pain and stiffness, tightness in my back. What can I do? Now that really is dependent upon what your bed rest prescription is. I've covered this before, but I thought, this bears repeating because when you're in bed rest, and it again saying, whether it's either house arrest, which I call, you're able to move around your house, but really kind of limited in your activity, or a modified bed rest where you can get up and go to the sofa or to an easy chair, but they don't want you to do anything, or strict bed rest where you are confined to bed. These can all have varying effects on your back, coupling that with the changes that are going in your body as a result of your pregnancy. So I just want to review some things that you can do in your bed that will help you kind of relax your back. Now here we are in my handy dandy bed. I love this little fleece thing. And one thing I want to say is make sure your bed is extremely comfortable, because if you're going to be spending a lot of time there, it needs to be comfortable. I also recommend, as usual, the body pillow. I mean, these things, my daughter has usurped mine and it now has a pink tiger cover on it, but it's your friend, it is your ally, and it is what's going to keep you going. I just had a funny thought. I had a body pillow when I was pregnant with my daughter, and now she has it. Go figure. Time does move on, moms. Anyway, I'm going to kick off my slippers because I was wearing those, and I will be here in my little stocking feet here on my bed. And I want to go over, to begin with, best positions for bed and bed rest. Now, many people, when they are on strict bed rest, are advised to lie on their left side to allow that blood flow up through the right inferior vena cava back to the heart. With the growing size of the pregnancy, if you lean on your right side, you can compress that and and constrict blood flow back to your heart, which not a good thing. So here we have, get my pillows, get comfy, the body pillow. And when you're laying on the side, you want to make sure that you raise your hips in alignment with your spine. So I always tell mamas, put the pillow between your knees. That'll pick up your hips, and that alleviates any pain or discomfort in through the hip area. Because when your hips are regular, what have you, there's kind of this downward slope. It's just the natural curve of a woman's hip. But with the added weight of pregnancy and with the relaxin, the hormone that's relaxing your soft tissues, getting you ready for labor and delivery, that can put a lot of stress and strain in through the hips. So put pillows through your knees, and that will help relieve some of the low back strain. Also, now most mamas on bed rest don't lay flat on their backs. But if you are lying propped up with pillows behind your head, getting you somewhat propped up, put a pillow under your knee, and I will show you just with this for now. And again, I'm laying flat. I'm just showing you this, but you want to put pillows under your knees so that you get a little bit of release in the lower back from your legs being straight. That kind of puts, when your legs are straight out, that makes your back arch, and that's not comfortable. So put a pillow up under your knees so that that low back gets pushed back into the mattress, and that relieves a lot of the pressure on the low back. And that's really what we're trying to do with the growing uterus. And what was I going to say? The growing uterus expanding during pregnancy pulls your whole spine and everything forward. This is just how it goes. But your body, your back muscles in particular, are pulling you backwards, trying to keep you in normal physiologic neutral. So you have this pull between the uterus and the stomach, everything going forward, and the back muscles going back. And that's where you're getting the discomfort of the overuse and the stress on the muscles. So what we're going to do today is just a very few things to do to release those muscles and to make them more comfortable. Now, if you're laying, if you are able to lay on your bed or in an easy chair, and this, you do not have to be flat. I'm going to be flat just to show you this, but you do not have to be flat. In fact, you probably shouldn't be flat because you're going to be again, compressing the inferior vena cava, but I am just doing this for demonstration purposes. And I'm going to go across my bed so that you can see me. And you want to bring your knees up and very gently tilt your pelvis back. And you'll feel your lower back being pressed down into the mattress or onto the easy chair or whatever it is you're laying on, onto the sofa. And then just release. And then just tilt back and release. And tilt back and release. Now, for you mamas who are on very strict bed rest and the doctor says, I do not want you on your back at all, blah, 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 blah. That's reality. You can do this on your side. And what that looks like, I'm going to grab the body pillow here. So you have the body pillow. You always want to put it between your legs. And you're going to do the same thing. You're going to tilt in and push back. And tilt in and push back. Now it's kind of hard to see, but what's actually happening is, best way to show you this is, and I'm going to show you this from here, but what I'm doing is I'm tilting in and then I'm releasing. So, and that's the motion I'm doing here on the pillows. So you bring in and you release. You bring in and you release. You bring in and you release. And that's just going to relieve some of the stress on your back. Now, if you are not on really, really, really strict bed rest, you are not to move, etc., then check in with your doctor before you do any of these. I do recommend cat and cow. Cat and cow, oh my God, it is like the best thing for your back. It is, I want to say stimulating, but if you have like an incompetent cervix, or you've had really kind of labile preterm labor, this is not for you to do. But if your doctor says, yeah, you're kind of on house arrest, you can move around, you can do this on your bed. Now you can do it on all fours. Or you're here, I'm sorry, I'm looking like I'm pregnant here. You can do it on all fours and you just kind of raise up and really sink down. Now you can see when you really sink down, you do put a little pressure on the lower abdomen. So if you have an incompetent cervix or if you've had some preterm labor, anything that's going to increase pressure here, you don't do this. But if your doctor said, if you're on bed rest for, I don't know, maybe placenta previa, because this doesn't bear down a lot, or maybe a little bit of elevated blood pressure, and your doctor says it's okay, you can go ahead and you can raise up and then drop down and really kind of drop your butt, because that's what's going to release this tension into the lower back. If it's uncomfortable for you to be up high, you can do them down low. Now I'm down here on my forearms. You go up and you can come down. You go up and you can come down. Now for those mamas, again, who the doctor says, absolutely not, you are not to do that. I do not want you up on your hands and knees, blah, 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 blah. That's fine. We're going to do it in the laying down position. So I'm going to use a smaller pillow here between my knees, because what I'm going to have you do, and I'm going to see if I can make sure you can see this, is okay, you've got your belly, you got the pillow between your knees, you're going to hold on to your knees and you're just going to push back and then push out and push back and bring it back out. Now it's kind of hard to see in that direction, so let me see if I can do it down here. It might be a little bit easier for you to see. Let's see, grab another pillow here. Okay, so my knees are being supported by this pillow. And so I've raised up my knees so that they're in line with my spine. Actually, this is a little bit high for me. This is a little bit better. And I actually have my hand, you can't see my bottom hand, but on my knee, and I'm just pushing back and then pulling forward. Pushing back and pulling forward. So basically the movement that I'm doing, and I'm just showing you this, I don't expect you to be up here, is you pull up and then you push back. And I'm accentuating this so that you can see. And here's what it looks like from the side. So you pull up and push back. And you're doing this lying down. So you're lying down, you pull up and you push back. And it just gives some relief to the back. Your back just takes so much abuse during pregnancy, trying to support all of your weight and the baby weight. It's really hard. The other thing that's really good to do, and this just reminded me as I was sitting here, is I call them frog legs, just because sometimes your hips and your back, this whole pelvis area just gets so stiff. So, I sit, my feet are together. I have black socks on, that didn't really help. But, and you just kind of stretch. Now, this is for those of you who can sit upright. Some of you, this is not going to be for you. You're not allowed to sit up like this. But if you can, you just pull up and then relax. Pull up and relax. And you might also feel this some in your hips. I know when I was pregnant, my hips were killing me so much of the time. Up and back. Up and back. And these are just very simple little exercises that you can do while you're on bed rest. They're not even really exercises, they're more like stretches. And there are things that I have mamas that I've worked with and talked with do, and it really just gives them some relief in the back. And don't forget, my all-time favorite, have a massage. And it doesn't have to be a big, huge thing. Have your partner just, I say, kind of take his or her thumbs and put them right on like the sacrum area, which is right down here on the lower back, and just kind of rub like this. I mean, it feels so good when you're pregnant because all that tension, all that pressure of your back trying to work and pull, it really feels good. You can be laying on your side. They can be given a little counter pressure. They can also get in your shoulders. I mean, the benefits of a wonderful prenatal massage cannot be overemphasized. But if you cannot afford someone to come to your home, because hey, it is not cheap, have your partner do it. Have a loved one do it. Maybe your mom or an aunt or someone who will be gracious enough to just rub your back and shoulders for you. It really, really goes a long way to making you feel better. So these are just some other tips for you to relax your back while you're on bed rest. It's hugely important, and I hope it's beneficial to you. If you have other tips, please share them with us in the comments section for this video. And otherwise, this is Darline Turner, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. Thank you so much for joining us today.